Good day! This is Lisatan Balagtas. Here is my return demonstration about pelvic examination. Let's start.
So before doing the procedure, we are going to identify the client and introduce ourselves. So we're going to identify the client using two matters, their birth name and their date. So this one will prevent us from doing the switching of the client during the procedure, and then introducing ourselves will build us the rapport between the nurse and the client. And we're going to wash our hands and put on a clean glove, so this one will prevent the cross-contamination and the passing of bacteria from nurse to client and client to nurse. After that, we're going to set up some privacy. So setting up some privacy will give the client and ease the anxiety of the client, and will give her the comfortness that she will need during the procedure.
Now we're going to gather all the equipments needed, which are the surgical gloves, a mask, and a speculum. Now here is my improvised client as well as the improvised vagina. So we're going to ask the client to void, then lie in a dorsal lithotomy position with pillow under her head. So voiding will prevent us from having an inaccurate measurement in palpating uterus. Now, we're going to position the improvised client in a lithotomy position on her back with her thighs flexed and her feet resting in examining table stirrup. So her buttocks should extend slightly beyond the end of the examining table. And then we're going to properly drape the client with the draw sheet over the abdomen and extending over the legs. So this one will prevent on having the bacteria and microorganisms and also the fluids to be scattered. Now, since we've already put on our examination gloves earlier, we're going to sit ourselves in a comfortable position, and with our gloved hand, we're going to separate the labia and inspect the external genitalia, which are the labia minora, clitoris, urethral orifice, and the vaginal opening. Make sure that you're going to assess and look for any abnormal appearances, discomfort, or pain. Now we're going to select a speculum of appropriate size and shape, so I've used the large speculum. Now we're going to lubricate and warm the speculum with the warm water. So this one will give us an easiest way to insert the speculum. Make sure that the speculum's temperature will be comfortable for the patient. Now place 2 fingers just inside or at the introitus and gently press down the perineal body. With your outer hand, introduce the closed speculum past your fingers at 45-degree angle downward. Blade should be held obliquely and slight pressure exerted towards the posterior vaginal wall. Be careful not to pull on the pubic hair nor pinch the labia with the speculum. Now rotate the blades of the speculum into the horizontal position, maintaining the pressure posteriorly. Now we're going to open the blades after full insertion and maneuver the speculum. Now under good light, we're going to inspect the cervix and inspect the vaginal mucosa by gently rotating the speculum several degrees in both directions. Now, after inspecting, we're going to loosen the screws and slowly withdraw the closed speculum. So since this one is an improvised client and improvised vagina, I'm having a hard time pulling on the speculum, but in real life, don't be too hard on pulling on the speculum since it might cause the patient pain and discomfort. Now we're going to do the internal examination. We're going to insert the lubricated index and middle fingers of the gloved right hand and palpate the vaginal walls. We're going to examine the fornices above and below the cervix. After that, you're going to gently withdraw your fingers outside the vagina of your client. For the bimanual examination, you may replace your gloves in order to prevent the transmission of bacteria. Now, I'm going to lubricate my index and my middle finger here, and we're going to examine the Bartholin's glands first. We're going to introduce our lubricated index and middle fingers of our gloved hand. Now, between the thumb and the two vaginal fingers by massaging the lower end of each labia minora. So here we're going to palpate the urethra against the symphysis pubis. Since we've already introduced the lubricated fingers, middle and index earlier, we're going to exert light upward and outward pressure. Now visualize the vagina and ask client to bear down. Again, using the two fingers of the gloved hand and with thumb abducted from your palm, identify the cervix. Palpate the uterus by placing both examining fingers in the anterior fornix above the cervix and sweep the abdominal hand forward over the abdomen, pulling the uterine fundus forward between the hands as possible. Palpate the right adnexa by placing both examining fingers in the right fornix and the other hand in the area of the right iliac fossa. Bring the hands together and move them centrally toward the pubic bone. We're going to repeat procedure on the left side. After that, we're going to withdraw our fingers from the vagina and ask the client to return to sitting position. We're going to remove our gloves and then do the hand washing. So we will touch the patient with a clean hand and prevent the transmission of infection. After that, don't forget to wash your hands, do sterile technique, and then you're going to remove all the drape on the client. And then help the client in a sitting position where she is comfortable and help her dress herself properly. And then we're going to explain what happened and what we saw, even a tiny information about it, and then ask if she felt any pain, any discomfort.
Okay, so after the procedure, these are the few things that I want to say. So the materials that I've used are just improvised materials since I don't have the actual material yet, and also my client is just a teddy bear, so this one is an improvised one, and also her vagina is just an improvised one. So I hope you learned something from this video, and thank you for giving a time and watching this one. Thank you. So that is my pelvic examination. So always remember, after the procedure, always wash your hands and document the data that you've observed, and always say thank you to the patient for cooperating and end the procedure nicely.